Kia ora koutou katoa, nau mai haere mai. Welcome to our regular update on our response to Covid-19. So I'm Andrew Old, I'm the Deputy Director General for the Public Health Agency, and I'm joined today by Dr. Anthony Jordan, Chief Clinical Officer of the Northern Region Health Coordination Centre of Te Whatu Ora Health New Zealand. Dr. Jordan is an immunologist and also leads the Northern Region Vaccination Programme, so it's fantastic that you're able to join us today. Thank you, Anthony. Today I will provide our usual assessment of our Covid-19 outbreak before handing over to Dr. Jordan, who will speak to some of the on-the-ground efforts to boost vaccination rates, before I then make some final remarks and open the floor to questions. Also, I did just want to acknowledge at this point that unfortunately, due to availability, we don't have a sign language interpreter at today's briefing, but live closed captions are available on the live stream on the Ministry's website, and a transcript will be published afterwards as well. So, to the numbers. As you all know, we have moved to weekly reporting of Covid-19 figures to better reflect changes in the pandemic response and in line with how we report other communicable diseases. The move to weekly reporting also means we're going to start separately publishing more detailed Covid-19 analyses. So next Tuesday, the 27th of September, we will be publishing our first weekly Covid-19 Trends and Insights report, and that report is intended to come out weekly on a Monday following that. These reports will include similar information to what is often covered in these briefings, such as modelling, case rates, those sorts of things. So in terms of the numbers for the week ending 18th of September, as expected, Covid-19 cases have continued to decline, with a 7-day rolling average of 1,337 cases per day. Likewise, Covid-19 hospitalisations were also down, 175 people in hospital on Sunday. The number of deaths reported with Covid-19 also continues to decline, with 36 people reported to have died with Covid-19 in the week to Sunday. At this stage, 8 of those are known to have had Covid-19 as a contributory or underlying cause. These trends are supported by trends in wastewater testing and case rates among health workers. So stepping back, we see from this slide a sustained decline in case rates across all regions for 5 straight weeks. This slide shows hospitalisations, and like cases, we can see that hospitalisations too have continued to decline across all regions for the same 5-week period. Deaths reported with COVID have also declined consistently now for 7 weeks. This is the latest modelling from COVID Modelling Aotearoa, and you can see that Covid-19 case rates have tracked in line with expectations for the past few weeks, and as expected, this downward trend is starting to slow and come to a possible plateau. Based on the modelling, we now expect that Covid-19 to probably stay at similar levels as it is currently in the coming weeks. We are in the process of updating our modelling for summer, which will give us the most up-to-date data we can on which to plan. So at this stage, there is nothing to suggest that changes that were made as part of the retirement of the Covid-19 protection framework last week has significantly impacted the level of Covid-19 circulating in the community. But as always, we will continue to closely monitor that situation, and given that we are only about 10 days past that, we would expect that any impact of that might be coming in the next week or two. However, with the lowest cases and hospitalisations in the country since February this year, our population well vaccinated and expanded access to antivirals, we are in a strong position as we go into the next period. But it's important to note that we can't be complacent. Covid-19 is not going away, and if we want to maintain our strong position, we need to continue to all play our part. Critical to maintaining our current approach to Covid-19 is continuing to retain a strong focus on vaccination, especially expanding the number of people who have had their first and then subsequent booster shots. While New Zealanders have high rates of vaccination overall, there remains a lot of work to do. especially among Māori and Pacific peoples who have lower vaccination rates than other New Zealanders. Currently, 56% of eligible Māori aged over 18 and 61% of eligible Pacific peoples over 18 have had a first booster. This compares to 73% of all eligible people over the age of 18. There is work underway across the three health agencies, the Ministry of Health, Manatu Hauora, Te Whatu Ora and Te Aka Whai Ora, to support eligible people, particularly those at higher risk of poor outcomes, and Māori and Pacific peoples to get their first boosters. Health districts and Māori and Pacific providers are providing tailored outreach services, including after-hours, weekend services and vaccination sites across pharmacies, pop-up clinics and in many community locations such as marae and places of worship. We're also continuing to target mobilisation support to 10 communities around the country where vaccination rates are comparatively low. And Dr. Jordan will speak more to vaccination in general shortly. As well as the ongoing importance of vaccination, it's also important that people continue to test and stay home if unwell, and remember to consider mask use if you're in situations that are crowded, confined, or if you're going to be in close contact with people outside your family for a prolonged period. Also, when you do test, please record the result at My COVID Record, as it remains a key tool for us to monitor the outbreak as it evolves. I did just want to make a comment now about long COVID. So for some New Zealanders, the disruption of getting COVID-19 will continue for months, sometimes years. We have been working on ensuring that health professionals have the right resources available to treat and manage long COVID, and are closely monitoring international developments in the area to inform our approach. We have recently released long COVID guidelines for primary care to add to an ever-growing list of resources on COVID-19 as health professionals around the globe learn more about this condition. Having these guidelines in place will help clinicians support their patients in the best ways to diagnose, manage and treat long COVID. We've been working on these guidelines with input from a range of health professionals and people with experience of long COVID, and we will continue to review and adapt them to ensure they're more accessible and continue to be to all New Zealanders. I will now hand over to Dr. Jordan. Thanks.
Thank you, Andrew, and kia ora koutou. It's good to be joining you again. Yes, the drop in COVID-19 case numbers, influenza and other winter viruses is proving to be a sustained trend. We are continuing to see positive signs across a suite of measures, further demonstrating our progress achieved together. I want to thank everyone for doing their part and the hard mahi of our healthcare professionals. Rates of influenza-associated severe acute respiratory infection have been at very low levels since July. They remain stable as well as comparable to previous years following a peak in about mid-June. And no cases were detected in the Auckland region in the 2 weeks to the 11th of September. General practice continued to be busy. Although volumes have been tracking down in the last week, they continue to see people returning for planned care. COVID-19 case numbers in aged residential care are continuing to decline as well, now at their lowest case numbers since earlier in the outbreak this year. On the latest figures, 6% of facilities are impacted by cases, a significant decrease from the 12% at our last briefing 2 weeks ago. Similarly, hospital beds occupied by COVID-19 positive patients are rapidly declining again, echoing a trend that COVID-19 and other respiratory pressures continue to track down. We anticipate that these will progress throughout September and October, and hopefully these improvements will continue. Pressures are being addressed by focusing on hospital flow, prioritising urgent care, and furthering our regional coordination functions. Turning now to our vaccination efforts across the Motu, to date we have delivered over 11,750,000 doses of the COVID-19 vaccine, which is a phenomenal effort, and by so many incredible people right across the country. It is important to note that we still have people coming into our vaccination centres, GP clinics or pharmacies every day for a vaccination. Those are not just people ready for a booster, but also we continue to see people opting to have their first doses. In terms of boosters, over 2.7 million people aged 16 or over have now had a first booster. These numbers are now picking up as people become eligible again after having had COVID. Also, just over 530,000 eligible people aged 50 plus have had a second booster as well. To that end, there are some incredible programs of work continuing across the Motu to focus on increasing these numbers further. Speaking to the work that I know of here in Tāmaki Makaurau, our Māori and Pacific providers continue to run pop-up events most weekends. We are now also offering childhood immunisations, including MMR and Boostrix at these events to help improve access to these critical vaccinations for tamariki. Other examples of work include, in South Auckland, work is underway to engage with priority groups, including antenatal hapumama, infants at 6 weeks, and 1 year for a targeted childhood immunisation program. We continue to support outreach programs such as SMILE, a health pregnancy awareness campaign, and a local community street chats program where there are safe places to kōrero with local healthcare people who can talk to whānau and individuals about the importance of immunisation. This mahi is underway via our community hubs, at events, and even in whare. Our mobile teams are still on the road and active, ensuring that we reach the whole region. And we will support a regional kapahaka event at Aotea Square next weekend with vaccination advice and information for COVID-19 and childhood immunisations. Childhood immunisations are a key focus. We need to lift our levels of immunisations in this area. These programs are developed by our communities, for the community and with the community. On a separate issue about planned care and the upcoming public holiday, looking ahead, the government have announced a one-off public holiday to be held next Monday, the 26th of September, to recognise the passing of Queen Elizabeth II. We are aware some local hospital networks are considering reducing planned care, given that staff will be seeking to observe this public holiday. Te Whatu Ora is supportive of this approach. In the case of any deferred surgery, we expect affected patients to be contacted promptly and rescheduled according to their clinical priority. We will continue to consider the national impact as each local network will work through this with their staff. Finally, next Monday also marks the start of the Mental Health Awareness Week. This year's theme is to reconnect with people and places that lift you up. The last couple of years have been tough for many of us, and it would be easy to feel disconnected from people and places that are important to us. So please take this opportunity to connect with a friend or loved ones, have a kōrero. This can go a long way in helping each of us through these tough times like these we've been through recently and improve our overall well-being. Kia kaha, and back to you, Andrew.
Thank you, Anthony. So, in summary, with cases and hospitalisations plateauing, we have reached a new stage in the pandemic here in New Zealand, and some of the requirements previously in place have been removed. But I do want to reiterate, COVID-19 is not over, and a big part of ongoing management is ensuring we continue to have a highly vaccinated population, especially amongst our most vulnerable communities. That remains a focus across health agencies and for our health providers across the country. Please, if you are eligible, get vaccinated and get boosted, not only for yourself, but for your family and your community. Finally, with the shift to this new stage of our COVID response, I can confirm that for now, this is the last routine COVID-19 press briefing we're planning to hold. I want to thank media for attending this briefing and the over 300 COVID press briefings that we have held since January 2020. And doesn't that feel like a very, very long time ago? In that very first press briefing, we talked about the novel coronavirus emerging in China, and there were 4 cases in Australia. We've certainly come a very long way since then. The virus is now part of our lives and will continue to be so for a very, very long time. But thanks to the steps we've all taken, we're now in a good position to manage it effectively in our communities into the future. Thank you, and we, both Anthony and I, are happy to take questions.
US President Joe Biden says the pandemic is over. Is he wrong?
Yes. So he is right in that the pandemic is at its lowest level since early 2020, and if you look around the world, that is the case. However, nowhere in the world has completely eliminated COVID-19, and we expect that the pattern of new variants and repeated waves is going to continue for some time. We all hope that we will not get the same sorts of devastation that the world saw in sort of 2020 and 2021, but it's certainly not over.
Could we then see what we've seen this winter happen next winter?
So we are hopeful that what we've seen this winter won't in fact happen in the same way next winter, but part of that is about our ongoing vigilance, making sure that we are monitoring for what's happening internationally in terms of new variants and keeping up with the public health measures that we've talked about. So we know that for the current circulating variants, the vaccines that we have available now are really effective at preventing severe disease, hospitalisation and death. And so again, keeping our vaccination rates high and getting those booster vaccination rates up is really important.
Comments like what Biden made make it unhelpful to encourage people to get vaccinated?
So you'll note that I've been quite careful to say a number of times that it's not over, because I do think that whilst we would all dearly love that to be true, me possibly more than many, the reality is that if we do stop thinking about it and go, well, I had my first 2 vaccinations, kind of done my bit, I can just carry on, that we do run the risk, particularly as the virus continues to evolve, that we will be back in a situation that we don't want to be in. So certainly our message is, isn't it great that that cases, hospitalisations, deaths are much, much lower than they are. Again, New Zealand as a country has done incredibly well internationally on almost all measures, and particularly we're sitting at about 2,000 deaths sort of attributed to COVID, which is much lower than comparable countries have seen. But if we want that to be our story ongoing, then we need to keep thinking about it.
What is the latest update on rolling out second boosters for younger people, particularly those under 50, as was reported in late August?
Yeah, so the Director General of Health has received advice from the COVID Vaccine Technical Advisory Committee on that question. She has gone back to ask some clarifying questions, including broadening the scope of what was included in that advice. That is expected to come back within 2 weeks, and so we'd expect to make a further announcement within the next 2 weeks on that. What I would say in addition though is, as we've talked about in this briefing previously, there are a large number of eligible people right now today who have not had their first booster, and you can't have a second booster without having your first, and who are already eligible for second boosters and have not yet taken that up. So I think those are the groups where we know the evidence is best, and those are the groups that we really encourage people to, if you are eligible, to take up those opportunities.
With the traffic light system being over, what's the plan? What's the formal plan for what happens if we have another surge?
Yeah, so in terms of questions about the frameworks that are going to replace that in the future, those are questions for government, and I wouldn't want to preempt that. I would say that in terms of our ongoing public health approach, so we will be doing regular public health risk assessments. We have another one of those scheduled for early October, which will inform updated advice to government about potential further changes. But yes, the questions about the way that those frameworks might look in the future are being worked through now and are questions for the government ultimately.
But how the ministry used to have a pandemic plan. It had an old one before this pandemic. Has it got a new pandemic plan that will take in a kind of COVID?
Yes, so we now have what's called the National Management Plan, which is currently in the process of being updated. So that's something that, as you say, we had in place pre-COVID. It was largely based around our experiences with influenza. As we all know, COVID-19 is not influenza, and it didn't behave like influenza, so we have taken the lessons from that and are in the process of updating that National Management Plan.
And any timeline on
that work is underway now, and that will be completed this side of Christmas.
On long COVID, we're hearing that it's adding strain to chronic fatigue support services. Is this something you're concerned about?
So I'm not sure whether Anthony can talk to the service side of it, but I would say long COVID on New Zealanders. As I mentioned, the evidence around long COVID continues to evolve, and much of what we know is based on people who had earlier variants of COVID. So the experience in New Zealand is almost uniquely an Omicron experience, and we really don't know what that's going to look like long term in New Zealand. But Anthony, did you want to? No? Go on. So one of the things I think we have provided guidance to the sector, and we will continue to work across the sector looking at what the options might be for services. One of the key things that will feed into that is what we think the size of the need is going to be, and so that's, as I say, a bit of an unknown at the moment.
So it's still quite unknown at this stage how many people who've had COVID will get long COVID.
Exactly. So there are some indications from overseas, but as I say, most of those are based on earlier variants. So literally only time will tell what the impact is truly going to be for New Zealand. And the other thing is long COVID covers a large spectrum of illness. So it's everything from people who have some ongoing symptoms past about 12 weeks, but that might be an annoying cough, through to people who have quite debilitating, fatigue and other sorts of symptoms. So there's still a lot we don't know, but it's certainly something that we're concerned about and working on.
I'm not sure who this one's for, but the vaccine supply, are we still, what is the country still bringing in terms of supply?
So we have contracts in place still for the vaccines. We actually have relatively good supply still in the country at the moment to meet the needs for all of the eligible groups, and as we will seek that advice to come out in the next 2 weeks, we do have stock to extend eligibility if necessary. So we're constantly reviewing the literature alongside PTAC at PharmAct, alongside the ministry and everyone else that has been involved in this, to say, is this vaccine the vaccine we need for the future? Because obviously we're seeing at the moment information come out around Omicron-specific boosters. I feel pretty confident at the moment that we should watch that space. We've got a good vaccine. If you look at first and second dose boosting effect on severe illness and hospitalisation, in a hybrid immunity situation where 50% of the population have COVID, I'm still confident we should continue on where we are.
And just a hospital busyness question.
Sure.
So we're hearing from, you say that the respiratory illness pressure's coming off, but hearing from people on the ground that it's still super busy in hospitals and in EDs. And what are you hearing in the northern, the hospitals that you're on?
I think that's true across the country. I think, yes, we're tracking down on some things, but there is a lot of other work that we have to do, work that is in the planned care space, urgent care space, so people that have been waiting to attend primary care, but they just need something right now. So it is still busy.
And in terms of the hospitals that you look after, what are you doing to help with that pressure on staff and on ensuring that patients can get care?
Yeah, so that's that regional coordination approach that we're looking at space across the whole region, the ability to get people in a timely fashion based on their clinical priority, sharing staff resource, so looking at our gaps regionally, making sure that we fully utilise our staff across the whole region. That's probably the best thing that we can do now to make sure that people are getting the care in the time that they need it.
And just one more on the vaccine. What about expiry? Are there any sort of big batches due to expire?
No. And if you look at the ministry website, you'll see we report, single-digit sort of numbers of vaccine due to expire. We also look as, we get stock in sort of relatively big lump sums, so to speak, and we have had a lot of extension dates for those vaccines that have been in deep freeze as well, so that's given us a relatively sort of long window of opportunity for stock to be used.
Just a couple more guys, anyone else?
Yeah, can we get an update on when we will see the results of the prevalence survey?
Thank you. So the question was about the prevalence survey. So there's two elements to that. There's an infection prevalence survey, and there's also a seroprevalence survey. It's true that we've been talking about that for a little while, and that is a little bit later than we had hoped. But at this stage, the plan is that we will have that in the community in what are we now, September, in October, so next month.
And when can we see the results of the application for the vaccines for under 5s?
Ooh.
So that work is still underway. We can provide an update after the meeting about what those timelines are. We're looking pretty carefully around the world where it has been rolled out to make sure, given we're in an Omicron-specific time, relatively low morbidity and mortality amongst that group, whether or not it warrants extending that down. As you know, those early clinical studies were relatively small, and we want to make sure when we look at larger population, real-world evidence, that remains an important part of it. But we definitely continue to monitor that evidence, and we'll be able to update you soon. Sorry.
This measles, how worried are you about the gap for both children and young adults, especially in the Auckland region?
Yeah, that's definitely a focus for me and my colleagues working in the childhood immunisation space at the moment. So we are using a lot of that resource that we had put forward for COVID-19 vaccination, taking those that are able to offer childhood immunisations, such as MMR, and moving them across into the outreach space, or even in clinics, events, to be able to get those MMR rates up at particularly at sort of 12, 15 and 18 months, because in 2020 we had that schedule change, so we need to some people may think, I didn't need it until 4 years, but with that schedule change, just making sure people realise we're actually offering it earlier now, getting earlier protection against measles.
And what do you worry about? What's the kind of worst case scenario, I suppose, that doesn't get sorted?
Yeah, measles is a disease that spreads very quickly. It's got a highly efficacious vaccine. There are some pretty bad outcomes. If we look back to 2019, almost half of some of our populations end up hospitalised with measles. We know you can get inflammation around your brain. We know that you can get pneumonia. So our focus at the moment, aside from outbreak planning, we never hope we have an outbreak, but that's not something you should ever plan for, is to get our MMR rates up, because that's our best defence against measles.
Thank you very much.